Hello friends, once again back into the class. Today's topic is inhibitors of transcribing enzymes. So these are anti-TB and anti-leprosy agents. In this case, the drug is rifampicin. So let's see the structure of rifampicin. So these are called Hansa drugs. So here we have naphthalene ring, and this naphthalene ring also going to have a one 5-membered ring. This 5-membered ring going to have oxygen at this position and a C double bond O group at this position, and here we have OH, here also we have OH, here also we have the OH group. So next, here at this position we have a group with the amino group. This amino nitrogen going to attach to a C double bond O group. Yes, again this C double bond O group going to attach to a double bonded carbon, and also it has a CH3 group, and here it has, and it is going to attach to a double bond, and again this is going to attach to a carbon, and again a small chain is here. Yes, we have to complete the chain. So okay, so here this position we have CH3 group at the top side. Here we have CH3 group at the bottom side, CH3 top side, next peak CH3 bottom side, and in between these two we have a OH group at bottom side, and this position, and again we have a carbon and a small chain again, yes, right, and again the carbon is there, and again okay. Let's see here OH at bottom side, we draw 1 2 3 peaks, we draw 3 peaks. Okay, so at this corner you write an OH here bottom side, again you write the OH at bottom side this position, and here you written CH3 at bottom side, therefore you write CH3 at the top side, and here you have to write a hydroxy group. You see here CH3 OH, CH3 OH, CH3, here you should get CH3, but instead of CH3 we are going to take OAC group. Okay, so next here we have another CH3 group at bottom side, and then this position again you have to write oxygen related group, therefore here you written OCH3 OAC, therefore here you just write OCH3 group, OCH3. So then this is going to attach to a double bonded carbon. This double bonded carbon has oxygen, that oxygen attached to here 5-membered ring, and that 5-membered ring also going to have CH3 at the bottom side. So friends, this is somewhat complex structure, but so if you try, then you can easily draw this structure. So this is the structure of rifampicin. Okay, so you just focus on this position. Here I am writing R, why I written R? So let's see. So here, okay, so this is the structure of rifampicin. So we already discussed, you just remember friends what is there. So here we have a naphthalene, OH, 5-membered ring is there. This 5-membered ring has oxygen and C double bond O group, and you just remember here amide group is there, after that 1,3-beta-diene linkage attached to this. After that you can easily remember CH3 top side OH, CH3 OH, CH3 O related group, CH3 O related group, double bond attached to 5-membered ring. So here I written R group here. So yes, so what is R? If you take R is equal to H, that is called rifampicin. The drug name is called rifampicin. Similarly, if you take R is equal to a double bond N and this is piperazine ring with NCH3 group, then this is called rifampicin, and these are comes under enhancement antibiotic drugs. These are comes under enhancement, that means Hansa chain is there, no, therefore this is called enhancement antibiotic drugs. So okay, so what are the properties? That means why we are using this medicine, the medicinal use of rifampicin. So this rifampicin active against gram positive bacteria, mycobacteria, especially Mycobacterium tuberculosis, so which causing TB. So gram positive bacteria, mycobacteria, especially Mycobacterium tuberculosis. And if you take in high doses, that means high concentration, it can be active against gram negative bacteria. So active against gram positive bacteria, mycobacteria, and also in high concentration active against gram negative bacteria. So only one drug in transcribing agents. Now drugs interfering with translation process, drug interfering with the translation process, these are antibacterial drugs. So in this, the first drug is erythromycin. What is the structure of erythromycin? Let's see the structure of erythromycin. Yes, okay, so it is so from now onwards the structure is going to be complex. So here we have right, you just draw the structure like this, okay, right. You start from here. Here we have C double bond O group, okay, CH2, and also we are going to draw like this, okay. So somewhat fascinating structure, therefore we can easily remember this structure. Yes, okay, then yes, okay. So this is a structure first you have to draw. Then let's start from here. We have this position oxygen is there, and here we have C double bond O group, nothing but it is a lactone. What is that? Lactone. So here after that, and at top side at this position we have CH3 group, and here at the bottom side we have some oxygen group. Then again, so at this side here we have CH3 group at bottom side, and again here we have some oxygen related group, okay. Here bottom side CH3 is there, and the top side we have OH group. So again at this position we have CH3 group at the bottom side, and exactly at opposite side we have CH3 at the top side, CH3 bottom side, CH3 top side, okay, right. So here we have OH at top side, CH3 at bottom side. So the same structure you draw here, OH at the top side and CH3 at the bottom side. Have you see here CH3 bottom side, CH3 top side, but OH top side, OH top side, CH3 bottom side, CH3 bottom side, opposite carbons. And at this position we have CH2 and CH3, CH2, CH3 is there, okay. Now so these two oxygens are going to attach an carbohydrate moiety which has oxygen and yes, oxygen present at that position. And you see, so this oxygen going to attach to carbohydrate. This carbohydrate has OCH3 at axial position, and again CH3 at equatorial position, and then the next carbon we have, yes, OH at equatorial position, yes, OH at equatorial position, and again this carbon has CH3 group at a equatorial position. So similarly here this oxygen is also going to have an carbohydrate moiety attached by equatorial bond, and oxygen present at this position, and it is going to have N and dimethyl amino group, and this position we have CH3. So this is the structure of, right, what is that? Erythromycin. So the structure of erythromycin. Remember friends, first you have to draw this complete ring, and here you remember C double bond O group, here we have lactone, so that means cyclic ester. So remember CH3 bottom side, CH3 top side, OH and OH. So here we have OH group. How to remember this? Exactly, oxygen is there here bottom side, here top side. So like that you have to remember. So what is the use of this drug? So this is used for upper respiratory system infections and also soft tissue infections. These are caused by gram positive bacteria. Upper respiratory infections, soft tissue infections caused by gram positive bacteria, and it is effective against venerable diseases. So whatever the diseases transmitted through sex, that means sexually transmitted diseases, that can be treated by erythromycin, and it is also used to treat pneumonia and bacteria enteritis. So friends, this is the use of erythromycin. So the next compound is tetracyclines. So this is what are the structure of tetracycline. Before going to start the structure of tetracycline, so you just comment who discovered or who find the medicine tetracycline. Okay, so let's see the structure of tetracycline. So friends, tetracycline, there is only here it has, yes, 4 rings. Yes, here we have 4 rings. The first ring is benzene. The first ring is benzene, and this benzene is going to have OH group, and right in the second ring we have double bond OH, okay, and here in the third ring here we have C double bond O group, and again on the fourth ring we have double bond OH. Have you seen this? OH, okay, double bond OH, double bond OH. In the middle ring we have C double bond O group, okay, right. Next, so on this carbon we have OH at the top side and CH3 group at the bottom side, and here we have NN dimethyl amino group, NN dimethyl amino group, and here we have C double bond O group, and this position we have an amide group, yes. So and in between these two we have a group that is OH. This is the structure of tetracycline. How to remember? 4 rings are there. First ring is benzene. Benzene has OH group, and the next ring double bond OH, last ring double bond OH, middle ring C double bond O group. In between these two we have OH and amide group C double bond O, NN dimethyl amino, OH at the top side, CH3 at the bottom side. So this is the structure of tetracycline. So but in our syllabus, friends, we have not a tetracycline, we have the structure of oxytetracycline. What is means by oxytetracycline? So nothing to worry. So here in middle ring you just put one OH group. This is called oxytetracycline. This is called tetracycline. This is called oxytetracycline. So the tetracycline structure is this one, and oxytetracycline structure is this one. Okay, what is the use of this oxytetracycline? So what is the medicinal use? Actually, friends, this compound is isolated from streptomyces griseus. It is a broad spectrum antibiotic, and it is a broad spectrum antibiotic. So this is used to treat respiratory infections and rickettsia, and it is also again active against gram negative and mixed infections of vulgaris. So friends, this is about the medicinal use of rifampicin. So next one, streptomycin. So carbohydrate antibiotic, we can say as carbohydrate antibiotic. Let's see. So the structure of, yes, what is this? Streptomycin. So this streptomycin structure is again very easy. So when you understand this, so first you have to draw a 5-membered ring. Obviously this 5-membered ring is also an carbohydrate, and you see here this has oxygen, and here we have CH3 group at bottom side, and here we have, sorry, here we have, yes, here we have CH3 group, and here and this position we have C double bond O H aldehyde group, and at bottom side we have OH group. Bottom side we have, so once again let us draw the structure. Okay, so okay friends, here we have a 5-membered ring. Okay, this 5-membered ring is a carbohydrate. Yes, it has which group? CH. So CH3 at this position, and here we have O, and this position we have C double bond O, yes, C double bond O H, aldehyde group is there. Here we have OH group, and here and this position we are going to have, obviously all oxygens are there, so OH is there, so some oxygen, and here also we have some oxygen group is there. Okay, again friends, this oxygen and this oxygen is going to attach to, so and again another carbohydrate, so again going to attach to another carbohydrate, so like this. So here we have oxygen, and here at equatorial position we have NHCH3 group, NHCH3 group, and here at equatorial position OH, again at equatorial we have OH, but here this is also present at equatorial position, but the group is CH2OH. So this is finishing of this carbohydrate. And again here we have another carbohydrate, okay, sorry, okay. So this carbohydrate attached to this oxygen through this bond, and here this has OH at equatorial position and OH at equatorial position, and here we have guanidine group. You know, guanidine is a NH double bond, yes, NH double bond, NH, and here we have NH2, and this position we have again OH group is present, and here again guanidine is there, yes, double bond, and sorry, so again guanidine group is present. So the guanidine is NH double bond, NH, and here we have NH2 group, friends. So this is the structure of, right, streptomycin. So let's see the structure of streptomycin is, right, I already told you one carbohydrate is there, but a 5-membered furanose structure. So here we have this position, after the oxygen we have CH3 at bottom side, and again next carbon OH at bottom side, aldehyde group is at top side. This is attached to a carbohydrate, so O present at this position, and at this position NHCH3, OH, OH, and CH2OH. So cyclohexane ring is there. This cyclohexane ring going to have 2 guanidine groups, and the remaining all are OH groups at equatorial positions. So friends, what is the medicinal use of this compound? So this compound streptomycin. So why we are calling streptomycin? Because this compound isolated from Streptomyces griseus. So here it is active against gram negative bacteria. So this is generally used for tuberculosis. The main choice of this drug is TB, to treat the TB diseases. And here, so it act on cranial nervous system, cause deafness. This is a side effect. The side effect of this compound is it directly going to act on cranial nervous system and cause deafness. So friends, that is about the structure of streptomycin. And the next one is about, right, chloromycetin or chlorophenicol. In paper 1 first chapter we discussed about prodrug. In that we studied one compound, yes, chlorophenicol succinate. So this is only, right, what is the structure of chlorophenicol? Yes, what is the structure of chlorophenicol? So let's see the structure of chlorophenicol and write. Yes, chlorophenicol. So friends, to draw the structure of chlorophenicol, you take the again benzene ring, and this benzene at this position we have nitro group, okay, and here exactly para position we have, yes, you just draw this chain first, okay, see 3 carbons are there, and here at this position we have OH group at the top side, and this is again top side going to have another OH group, yes, OH and OH, and here we have N, and this nitrogen attached to C double bond O group, and this is attached to a carbon which has and 2 chlorines, just 2 chlorines. So this is the structure of chlorofinical. Okay. So the chlorofinical structure has benzene ring with nitro group at this position. After that, you remember 1, 2, 3, and here we have OH, here we have OH, but these two are at the top side, and here we have NH, C double bond O, CH, Cl2. So what is the medicinal use of this compound? So friends, this is a naturally occurring compound. The naturally occurring compound is D minus threoisomer. What is the naturally occurring compound here? D minus threoisomer. So this is used to treat serious infections caused by both gram positive and gram negative bacteria, and it is also bacteriostatic agent. It cannot encourage the growth of bacteria. So friends, this is the structural features and the medicinal use of chlorofinical. Let's see the synthesis of chlorofinical. So the synthesis is started with yes, ethyl benzene. Synthesis started with ethyl benzene. So on chlorofinical we have nitro group at para position, therefore use nitration reagent HNO3 H2SO4. This is a alkyl group, that is electron donating group, so favorable for electrophilic substitution at para position. So nitration takes place at para position. Now this compound is an oxidation. What is a C2H5? Nothing but C2H5, nothing but here we have CH2 and this, and here it is CH3. So when we are doing oxidation, this is converting into C double bond O CH3, that CH2 converting into convert into C double bond O CH3, paranitro acetophenone. So next it is on bromination. So generally we use bromine acetic acid. So this active position undergoes bromination, we get this compound. Now this compound is on treating with, yes, treating with, so yes, we are treating with CH26N4. This is going to, yes, convert this bromine is replaced by NH2. Now it is on acylation using acetic anhydride, right? The NH2 group undergoes acylation, convert into NHAC, C double bond O CH3. This is on treating with formaldehyde. So treating with formaldehyde. So this formaldehyde, actually this reaction takes place in presence of base, yes, presence of base. Here base takes the proton from this position, and that carbon is converted into carbanion, and we are taking, yes, what is this? Formaldehyde, C double bond O group is present. Now this negative charge attacked at formaldehyde, this group will convert into, yes, now this is converted into, carbon is going to attach to CH2, it is converting into O minus, O minus take the proton, convert into CH2OH. Now this is on reaction with, right, aluminium triisopropoxide. Actually this reaction takes place in the solvent isopropyl alcohol. So this is a reduction reagent. What is the reaction? Reduction. So this reduction convert, this is the reducible group here, C double bond O group undergoes reduction and convert into OH. So now I want to remove acetyl group. For that, so treat with HCl. So then this HCl, yes, convert this NHAC into NH2 group. So after that, but we need D minus threoisomer. For that you do the resolution. Ante, so now first we are using HCl to convert NHC double bond O CH3 to NH2. Here we need OH at top side, we need OH at bottom side. 2 carbons are chiral center, but we need thrioisomer. Therefore, we are separating those 2 compounds. Yes, this compound has obtained. Now, this compound is finally treated with finally treated with what we required there. On NH nitrogen we have C double bond O CHCl2. Therefore, amine can easily react with ester. Therefore, CHCl2 C double bond O CH3. So, this has lone pair of electron attack at this position and methoxy group will eliminate there. Finally, we will get the compound chlorophenicol. Friends, this is the synthesis of chlorophenicol. So, next topic is drugs acting on immune system. So, already most of the candidates from biology background, I think not necessary to explain what is the properties of antibody, antigen, etc., etc. If you want any information, you just go through the notes. So, not a problem here. So, here immune system, there are 2 types, humoral immune system and cellular immune system. Okay. So, right friends, here there are 2 types of drugs in this case. So, those drugs are immune suppressive agents, immune enhancement agent. That means, which is going to stop the immunity effect. These drugs generally used during the organ transplantation. If you want to change the heart, if you want to change the kidney, any organ, if you want to change any organ, we have to suppress, we have to stop the attacking of immune system of our body. So, those drugs are called immune suppressive agents. The next one, immune enhancement agent. So, in today we are suffering with COVID-19. So, to treat the COVID-19, actually we need high immunity power. So, to that we are going to use these drugs, immune enhancement agents. So, in this the first compound is cyclosporine. So, this cyclosporine structure, so it is somewhat very complex structure, but so you remember friends. So, how to remember the structure? Okay. So, to remember the structure, so you see the first amino acid is, so where it is, this is this see first amino acid. This first amino acid, you have to focus on the R groups only friends. The first amino acid is the double bond containing amino acid, this one. So, what is there? OH, CH3, CH2 double bond, this double bond containing OH. Right, next, the next second one is alpha amino butyric acid. Next one, alpha amino butyric acid. So, you just go through it friends. If you have interest, you just learn this structure, otherwise you just skip it. So, this much of complex structure cannot be remembered very easily, but who have interest, they can learn the structure. Okay. So, what is the use of this compound? Cyclosporine is immune suppressive agent. So, generally it is produced by fungus. This compound produced by fungus, Tolipoclodium inflatum, Tolipoclodium inflatum, and generally this is used during organ transplantation, and these are called immune suppressants. These are called immune suppressants. Okay, next, immune enhancement agents. So, what are the immuno enhancement agent? So, in this category generally vaccines will come. So, these are, so what are the classification of vaccines? So, you see here, right, microorganism, bacteria. So, bacteria which causes tuberculosis, cholera, plague, viral. So, what is the virus? polio, influenza, yellow fever. So these are the diseases. Now these are completely inactivated now. So these are now continuing attenuated. Okay. So now what is the drug we are using as immuno enhancement agent? So the compound name is levomizole. What is the structure of levomizole? You see, simple structure. The levomizole going to have, yes, a bicyclic ring with 5-member rings. So two 5-member rings are fused here, and here we have double bond N, and here also we have nitrogen, and here also we have sulfur, and this is going to attach to a phenyl group. So this is a chiral center at this position, hydrogen present at bottom side. So this is the structure of levomizole. Okay, so the levomizole. So the levomizole is used to treat anti-helminthes, used as anti-helminthes. So this is effective against roundworm and hookworm. Effective against roundworm and hookworm. Here these generally cause stomach pain. So in intestine or in liver. So friends, let's see the synthesis of levomizole. So for that we are taking chloroacetophenone. Chloroacetophenone react with this compound. So what will happen here? Yes, bromine from here and hydrogen from here in presence of base. Okay, so we get this compound. Now this compound is treated with acetic anhydride. So here only this nitrogen has a hydrogen that will be undergoes acylation, convert into double bond N AC. Now this is on reaction with sodium borohydride. Sodium borohydride is a reducing agent which convert C double bond O group into OH. So now you treat this compound with thionyl chloride. Treat the compound with thionyl chloride. This thionyl chloride convert this OH into Cl. Finally, you treat the compound with acetic anhydride. Now this Cl containing carbon is going to attach to this carbon. We get levomizole structure. So friends, this is about the synthesis of levomizole and the complete chapter of drugs acting on genetic material and immune system. Friends, thank you.